Welcome to the Honest Health Podcast with your host, Jeffrey Burke. Honest Health brings you the brightest minds in the natural products industry, as well as athletes and entertainers. Jeff will keep you entertained and informed while educating on how to be successful on your healthy journeys. Now, here's your host, Jeffrey Burke.
Hello and welcome back to the Honest Health Podcast. Dr. Jeffrey Burke here. I'm so glad you're here today. As usual, as always, another awesome guest for you to sit back and listen to today. You know, people asked me the other day, how do I choose my guests? Good question. I think a lot of them choose me, and a lot of them I have a history with. And I think a lot of them see what all of my other awesome guests are doing, and I think they have a really good amount of information to share. And like I always say, you never can judge where the great information in your life comes from. You need to just take that information and run with it, because you may be really surprised where that one piece of the puzzle that you've been missing, it may come from someplace that you never, ever thought it could come from. So sit back. My guest today, Dr. David Hopper, and we're going to be talking about some really good things today. We're going to talk about the industry. We're going to talk about that question that we have to ask ourselves. Are we listening and communicating with the people around us? And are we communicating with ourselves? So help me welcome my guest. Hey, Dr. Hopper, how are you?
I'm doing wonderful today, Dr. Jeff. Thank you so much for having me on today.
Well, you know, I like what you do, and I like what you say, and your reputation precedes you. And I think that's really, really important. And I think that today it's all about messages, and it's all about feeling comfortable that we can ask questions. And there are people out here that have really valid answers. So I think a lot of it is realizing that we personally don't know everything ourselves, and also realizing that we need to reach out a little bit. So let's just talk a little bit about you and your background. If you had to do your own natural bio of yourself, how would you describe where you are right now in the industry?
Well, we have to admit that we don't know what we don't know, right? That's huge, man. All the time. But yeah, where I'm at in the industry right now. So I'm a natural health care practitioner. Been so for about 12 years now. Been in and around the industry for honestly most of my life. What I've kind of evolved into at this point is doing a lot more personalized coaching. So whether that is online, whether that is a bit in person as well, still at this point. And then I also work with a lot of wearable tech companies. So a lot of these companies are trying to start up right now, and they need somebody to come in and validate what they're doing, tell them if it makes sense from a user perspective, from a clinical perspective, all these kinds of things. So I get to go in and do a lot of that work right now too, which is actually really fun, and I really enjoy it, and it makes a huge impact. And gosh, right now couldn't be a better time for that whole industry as well, as you know, the wearable tech is really exploding. So that is where I've been and where I'm at right now.
You know, I got to tell you, there was a time when we had no idea what was going on underneath the surface in our bodies. We had no idea. We had to go to a doctor and then hopefully find a doctor that did adequate and proper and quality training and testing. And then we had to wait for results that could take, anywhere from a week to 2 weeks to get everything as easy as an accurate blood pressure check or anything else along the way. But to your point, this wonderful new wearable technology, I mean, this is amazing that we can actually have this information at our fingertips. And that's kind of where the world is going, speed of light information and instantaneous answers to questions. And I see it doing nothing but just continuing to broaden its spectrum and touch more people along the way. So what a great thing to be in.
Yes, absolutely. It's more accessible than ever. And as we see this evolving, a lot of people in the industry are seeing this as, man, our doctors can have continuous monitoring of us. And we can, and as clinicians, we can see far more patients than we used to be able to see. We can do a much better job of monitoring these patients and at a distance, so they don't have to come to be in front of us all the time. Of course, it's still wonderful to see your patients face to face. But we can do that without the inconveniences, without the hurdles. And the biggest thing, Jeff, is we can catch these early warning signs, right? So that way we're not doing reactive medicine, which is all we have been doing, right? And we can start doing preventative medicine. We can see these early warning signs and we can say, hey man, this looks like you are going to have a cardiovascular issue. Or even as simple as, hey, it looks like maybe you caught the flu, right? And let's help you prevent from your body ever falling completely into that. Or let's help you get through it faster, right? And it's wonderful to help people with that rather than wait 2 or 3 days, right, and then end up in the ER sitting there for 3 hours, or maybe 8 hours.
I was going to say 3 hours. That's a vacation. Yes. 20 hours. There you go.
Yeah, and just to get something prescribed, right? When you could have just avoided it in the first place by catching some of these early warning signs that your body was giving you, right? It just as you said early on, right? We just have to tune into those things. So.
Well, my mother passed away in January, but she was in an adult care facility. And I would say 80% of the people that were in there were wearing an Oura ring. And they were all in their 70s and 80s and older. And they found, when I asked the proprietors of this adult community, they said it has made a dramatic difference on monitoring and being ahead of the game with some of these problems that were affecting the people of that age bracket. So, for them to even think about doing something like that is already a huge step.
Yeah, absolutely. When you can see somebody's oxygen saturation dropping consistently, man, that's a great clue that you should step in and do something. When you can see their sleep quality changing, when you can see their heart rate changing, their HRV, I mean, you can monitor all these things. And again, it doesn't even have to be right in front of that patient. We can do this from across the world, which is just unbelievable to think of, versus what you were saying in the beginning, right? When it used to be you had to wait weeks to get in with your primary care just to take your blood pressure, and compare that to the last time you were so nervous to be there.
Which is still a lot of the time for many of us. I still even myself get a little white coat syndrome. I had dental work done yesterday, and I don't have hypertension, but I definitely have white coat syndrome. And the doctor took my blood pressure and he goes, "What's this?" And I'm like, "Give me 5." And I just got out of my head for a minute, and he goes, "Oh, okay, there you are." And I'm just like, so there are us even in the industry that get a little bit of white coat syndrome, and we have to be fearful. So, another thing I want to talk about as well about this, learning things, our body communicating with us. Where did we stop communicating with ourselves? When did we stop accepting the signals from our body? I mentioned to you before the show, I've been doing a lot of work with younger adults and like later teenagers, and I find it very difficult to have a conversation. It seems like they don't look you in the eye. And, I'm a talker. I mean, that's all I do. I mean, I get paid to talk now, and I got yelled at my whole childhood for talking, but now I love it. And I can't have a conversation, because I don't know whether we blame the devices. I don't know whether we blame the amount of time that they're on their devices, but it seems like social skills have gone away. So not only are they not communicating as much with the people around them, I don't think they're communicating with themselves as well. So I think that takes them out of that knowing feeling that something may be an issue. So I don't know. Are you saying that at all, or is it just me?
No, 100%. So the interperson communication is without a doubt has gone down quite a bit. You literally see groups of teenagers all standing there texting each other rather than just talking to each other when you're right next to each other, right? That's maddening to me. And actually, so I teach at a university, and it's graduate level. It's a doctorate programs here, and these students, I was having a conversation with some of them during one of our labs, and the girls were telling me that if a guy came up to them in the bar that they hadn't prearranged with, they would be creeped out. And I'm like, you would be creeped out? That's how you're supposed to, that's how you meet people. You go up to, you see them in a bar and you go approach them. That is how it's supposed to work. And they're like, that would be so creepy. I'm like, what?
Oh my goodness. So that's kind of where we are going in that direction.
Right. And there's a mix, right? But without a doubt though, it has spilled over to our own bodies though too. And a lot of that is that we've been trained as a society that we don't understand our own bodies, and we have to go to these so-called professionals who are going to tell us about what our body is telling us, right? Now, I don't know about you, Jeff, but I live in my body 100% of the day. And I think most people listening to this probably do as well. Um, so I think I would probably be the best judge of what's going on with my own body. The problem is that, again, we've been told that we don't understand. So we just kind of stopped listening, you know? So Jeff, I'd like to compare this to if you took your car to a mechanic, right? Um, so, you know, say you're driving your car and your check engine light goes on, right? Um, Initially, you're going to say, yeah, whatever, right? Especially if there's nothing wrong with your car. You're just going to say, it's no big deal. It's an accident, whatever. And you can drive weeks, months with that check engine light on, and you don't understand what's going on. And I certainly don't understand what's going on, right? But I know that that light is a warning sign, right? So I'm going to bring it to a mechanic, and I'm going to trust this mechanic to tell me what's going on with my car. And when I get there, if the mechanic were to tell me something like, hey, Dave, yeah, there's a check engine light on, but let's just put some tape over that check engine light. Let's just cover that thing up, right? Or worse, if the mechanic said to me, hey, Dave, you know what? I think there's something wrong with the light. So why don't we open up your dashboard and we're going to remove that light bulb, right? I think a lot of us intuitively, even though most of us listening here don't know a thing about cars, a lot of us intuitively would probably say, that doesn't seem right, right? Because probably that check engine light came on because there's something wrong with the car. There's something going wrong in the engine. And if we just let that check engine light go, a small problem is going to turn into a big problem. And then we're going to end up with a car that is dead, right? Or we're going to have a broken down engine and we're going to be getting towed somewhere, right? Something like that, right? And then if we take out the light bulb, well, how does that make sense, right? Now we're just taking away the car's ability to communicate with us, period. And that's the unfortunate thing, is that we've been trained that anything that pops up in our own bodies is the problem, right? So any kind of, symptom, just like a check engine light is a symptom, right? Any kind of symptom that pops up, we're taught to go to the professional, and the professional is going to tell us, let's push that symptom down, right? Let's ignore that symptom. Let's take this, ignore what's going on. Let's remove the cause of that symptom, right? Let's move on. Okay, well, could it mean something further down the road? Nah, right? We'll just ignore that. We'll just ignore that. So that's kind of where we've gotten. And my whole thing is, Jeff, that I want us to be paying attention to our check engine lights. Every check engine light that pops on in our body, right? And there's hundreds, hundreds of these check engine lights that we have. Every single one that pops on, it means something. But we forgot how to interpret those signals. We forgot how to look. Right? We forgot how to listen to our own body that we live in all day long. And if we just take a second and think about it, a lot of times these things make perfect sense. Right? And we can find our own solutions. But again, we have to reconnect with our own bodies.
Well, I have a great friend that's a mechanic, and, he's worked on my cars all the way back when there was no technology, no diagnostic at all. And, I've been around for a long time. He would just kind of listen and kind of guess his way through it. And I was to see him, I think probably the end of the year, and he plugged into this device. It ran through, it calibrated, it said, okay, it's your number 3 sensor. And I'm like, cool.
Yes.
How much is that? So, but that was it. They figured it out. If you think about medical, remember when the doctors used to go around the town and go door to door with a little black bag? Everything they had was in that little black bag. We had no diagnostic. There was a lot of guessing involved because that was the way it was. Today we have CAT scans and MRIs and radiological type procedures and blood work and cultures and things today to help give us that little plug-in thing that we get in our car. The same kind of thing. So the diagnostic is there. I always say that if we had a red engine light in the middle of our forehead and it turned red when something was wrong, people would pay more attention, because they wouldn't want to walk around with people saying, hey, your light is on, there's something wrong with you. We would want to do everything we could, but we don't have the same kind of attitude about other things. with maybe an urgency situation. But, I think that if it's going to make us look like we're not doing our job, there's a better chance of us paying attention. So I think people want to know. I think a lot of us are
Yes.
scared to know when something's not right. There is a fear factor there. But I think these devices are quite amazing. I have a really good friend, and her husband can't get him to go to the doctor, can't get him to do everything because he's a naysayer on everything. And God, I love him dearly. But so she bought each of them the rings, and they both put the rings on. All of a sudden, he saw his calibration and his information coming, and he's like, I have hypertension a lot. And my blood sugar is like crazy. And I've got this. And he said, all right, schedule me for a physical.
Yeah.
That's what it took. He had to see it like in print. He had to actually see it. So I think they really do have their place. And I think that you're definitely in not only what's coming in the future, but what's necessary today.
Yeah. Jeff, I love the idea of installing a light in the center of all of our foreheads. Yeah, that's
Boom.
That would actually get us to perk up a little bit. I do like that idea.
I think so.
But yes, the wearable tech has, fortunately it has gotten to the point that it is accurate enough. By no means is it perfect, right? And but a lot of these devices have gotten good enough that we can tell that something is going awry. You can see that, and you can see it very early on. And just like your friend, right? You can go, oh man, like this thing is telling me that I feel horrible. And you know what? I actually do. It's just really hard to admit it to yourself.
True.
Like, for example, Jeff, I was a professional athlete, and you're literally taught to ignore when your body is tired, ignore when you're tired, push through, right? Keep on driving, right? Doing those things. And you do, right? And then you wonder why you break your arm. You wonder why, you fail, in this way or that way. You wonder why you get sick. But when we're paying attention and we get out of our own heads, stop being a hard-headed male like so many of us are. Yes. And you admit that, oh shit, all right, this maybe I am actually getting sick. Maybe I should do something about this. It's a big ask for some of us, but when you have the raw data sitting there staring you in the face, when you have that blinking light in the center of your forehead or on your phone, right, telling you, it is really hard to ignore. And it does open us up to the possibility that maybe there is something wrong with me, right? And by no means does that have to be a huge thing, but maybe there is something that I should start paying attention.
Let me ask you a question. How do we get the mindset out there to think preventively and to think about things before they become huge? I mean, how do you I don't know if you could teach that awareness. I don't know whether it takes a tragedy or a major trauma to have people say, all right, moving forward, I'm going to pay more attention. I wish there's something we could put in the water, to just kind of make people be a little bit more aware, and maybe at a younger age, not maybe being 75 and thinking, well, yeah, I probably need to pay attention because I'm old now. What about when we're younger, paying attention? Because we have a lot of younger people today that are now dealing and suffering with old age, one-time old age only health problems at a much younger age. I talk to 30 and 40-year-olds that if you had to measure what's wrong with them, you would think they were 70 or 80. They've got so many things. Now, are many of those things life choice induced? Absolutely. Dietary inactivity, stress levels, lack of sleep, all that kind of stuff. Those all add up to that. But any ideas on how we teach awareness?
Yeah, I like to start with what most people dislike the most, right? I don't like getting sick. I would imagine you don't like being sick. I imagine most people listening here don't like being sick, right? And what if I told you that if you just paid attention to some of your metrics on a daily basis, or even just set up alerts, that you could possibly avoid getting sick, right? And actually, research shows that you could predict illness 2 to 3 days before the onset of symptoms when you're tracking your biometrics. And like, how amazing is that, right? That we can see this. Well, I'm pretty sure that anybody listening here, if I told them that, hey, you know what, we have this, what seems like magic, but hey, it isn't magic at all. It's just looking at what your body's telling you from a deeper standpoint that you could actually avoid getting sick sometime. Well, that would be awesome. I think that would get a lot of people to pay attention. And then you could look at simple data points and see that, oh man, I'm trending down over these few days. Let me do a self-check here, right? Maybe I have been having a headache. Maybe my sleep has been off, right? Maybe I am starting to get some of that itch in the back of my throat. I'm getting kind of nasally and mucusy, right? Maybe I should do something about it before I am sick all the way, right? And when you see yourself making little wins like that over something that we're all very familiar with, right, then it starts to get us to pay attention a little bit more and say, well, could this be preventing heart disease down the road, right? And yeah, I mean, I would sure as heck hope so. But can we say that? I don't know, because if you're doing a good job, it's I like to say it's kind of like those supplements that you take every day. If they're doing their job, then you never really know, because you don't wind up with those illnesses, right? That's what we all hope and pray is going on. So we hope that the same thing here with this, right? That if we're tracking our data and we're reacting to it appropriately, then we never experience these things. And hopefully we don't see the things like, like the type 2 diabetes that is so common nowadays, like the inflammatory bowel diseases that are so common nowadays, the infertility issues, and all of these, which granted is a lot of sympathetic overdrive kind of things going on, which also makes us more prone to these illnesses.
Well, it's funny. One of my first mentors in the field way back in the, oh my Lord, late 70s, early 80s was Dr.
Yes.
Atkins. And he was one of my strong mentors, and I was young and I was still learning, and he took me underneath his wing. And he said this quote that I call all the time. He said, there will come a time. Now, you remember, this was 46 years ago. He said, there will come a time when this entire nation will be carbohydrate junkies, sugar addicts, and we will pay the ramifications of those choices with our health through everything from cardiovascular disease, blood sugar problems, circulatory, immune problems, all this stuff. And I said, I wonder if it's really going to get that bad. Well, here we are.
2026, it happened.
And we are carbohydrate junkies. And when people try to cut back on their carbs, I mean, they go through massive withdrawal. And because food is a drug. We know what we like, even though we may know it's not good for us. We still do it. But the thing about it is food is a big part, as big of a part as sleep and exercise and mental health and mental awareness and things like that. But I think we have to start on the food level too.
Absolutely. I mean, that's pretty amazing that you got to work with Dr. Atkins for.
Yeah. I've been very blessed. I work with the best of the best in this industry. So I count my blessings, heavily blessings all the time.
Yes.
You wrote a book. If you have one, can you show people the cover?
It is, this right here, The Secret to Never Getting Sick. Why you got sick and why it's your fault.
I love that. Available Amazon.
Or Audible, depending on how you like to consume your material.
What was the driving force, even though I know what it was for the book?
This actually started about 10 years ago, right? That I started writing this book. Jeff, if we can go way back in time for a moment.
Please
I was
do.
brought up in a family that health was number one priority, right? Nothing else really mattered, right? Health had to be number one. I grew up in households where we had a full gym in every basement of my houses, right? And not like we were mega wealthy or anything like that. It was just priority, right? We needed to have a fitness center in our basement. My dad is in his late 60s at this point, and he has a six-pack. He's a big ripped dude. It's like amazing, right? My mom has ran close to 80 marathons at this point, including one in every single state. These are the people that brought me and my siblings up, and health was just number one. And I never thought weird of that, honestly, until I got to middle school, high school age, when I started having sleepovers, and I'd go to other people's houses and I'd be like, you mean your whole family doesn't get up and work out first thing in the morning? and I'd be like, wait, I'm the weird one?
I love that.
You know, right.
But in a good way.
So that was like a big, like, oh, that's weird. So it was that stuff. And then, you know, I started having like friends' dads would ask me like, hey, what kind of exercises should I do for this? What should I do for this? And when I was like 14, you know, so that got me into personal training, which led to, you know, I was like, well, I want to be a doctor. And then it was, well, what kind of doctor? And just because of the way that I was brought up, I actually met this guy who ended up being a mentor of mine, and he was explaining to me different types of doctors and what they, you know, what they look like, right? So you go to this kind of a doctor, this is their solution. You go to this kind of a doctor, this is their solution. And the natural health route just fit with my beliefs, with the way that I was brought up. So I went that route, and was very fortunate to be able to become a doctor. And when I started getting into that, what I noticed was I can only help one person at a time, right? And in a day, I can only help so many people. And in a week, in a month, it's very limited in how many people I can actually reach and affect. And that started becoming very frustrating. Um, and anyway, long story short, right, in about 2017, I was like, what if I write a book? Then I can get a lot of this information out to many people. So I started that process then, and you know, it's only taken almost a decade. but that was the driving force. I wanted to make a much larger impact than just seeing people one to one, because that's slow. That's slow, and we can do so much more before people walk in my door, before people ever have the need to see me, to see you. They can prevent this stuff, right? And I took it for granted that the information that was in my head, because I grew up this way, that this is just something that everybody knew, but it wasn't. Far from it. So yes.
You know, it's I kind of felt the same way about doing my radio shows. You know, I did my radio show for 42 years. You know, so the thing about it is I had the same philosophy. I can do one-on-ones. I can do small consultations. I can do small groups. But the radio show, I mean, I can cover a lot of territory at one time and touch a lot more people. Now, many of those people I touch, I may never meet. And I may never hear from people that I touched in other states or other countries. That's okay. But the message was still nonetheless getting out from these amazing guests that I had on my show with me and the conversations that we were having. So it's the same kind of idea. I felt the same
without
way.
a doubt, this is it's so great to be able to spread such a wonderful message, and in your case, such an array of awesome messages to so many people. So yeah, it is wonderful.
Well, you know, and with the podcast now, I'm loving it because, you know, we talked about this briefly before, you know, for so many years, decades, thousands of shows, I never got to see my guest. I never had the facial interaction. And let's just face it, I have a very big amount of gift of gab. That's just who I am. But I love the interaction. I love being able to see the person I'm talking with and, you know, and have that interaction. I think it brings about a better conversation, a more engaging conversation. Although the radio was great, it was what it was, you know, it's fantastic. But this to me, I think it makes it great for people that want to maybe just listen to the audio. That's fine. But I have a lot of people that like to watch the interviews. They like the interaction, and as do I. And I think it allows me to present to my listeners and the people that follow the podcast a variety of content-based conversations, you know, so that people can learn about a lot of things. I never want people to get comfortable with who I'm going to have on next. I'd rather have you like, okay, now who's he talking to? That's what I want, you know, because you don't know if you're going to hear an athlete or an entertainer or an author or a physician or the owner of a company that makes nutritional supplements, or have a manager owner of a health food store on here who I made my retailer of the month to talk about all the wonderful things they're doing for the customers that come in their store. So everybody has something to say. The hard part is listening, knowing that we all personally do not have all the answers, and opening up our brain and our hearts to information and saying, that makes sense. I'm going to try that. And that's the whole idea of this
Yes.
information-based
Yes,
industry.
without a doubt. Everybody has a message, and they're all awesome messages. But yes, there's a ton of them. There's a ton of them.
How do you feel our natural products industry is doing these days? Do you feel that we're bringing the right message? Have we made it too confusing? Because I know there's so much competition even within the industry itself, and so many different versions of a lot of the same things that are out there. I think we made it a little bit difficult, where once again, that's where information and
Yes.
education comes in.
Wow, I just saw a post yesterday from Dr. Mark Hyman, actually. You're familiar. And it was thank you, Pepsi, you solved the problem, because they released a prebiotic soda. And it's so confusing. I think nutrition and nutritional supplementation is one of the most confusing things for consumers, especially your average consumer who doesn't have any kind of health education, because in their eyes you see prebiotic Pepsi. Oh, excellent. Well, I'm going to get that, and this is going to be healthy and good for me, right? And you go and you consume this thinking that you're doing something positive for your health, and in reality, it's still not good for you in any way. It just has that label and one extra ingredient that maybe helps your microbiome. I don't know. So that's the confusion.
Agreed.
Then we have things like you have Cheerios that tell you that they're heart healthy, and Pop-Tarts, and you're like, what? No, they're not. But that is so confusing. And then when you get to the supplement industry, I do have to say, there are a lot of great nutritional supplements out there, and thankfully that is getting better and better. Initially there was a lot of questionable companies out there, but now there are so many great supplement companies that you can point at, and you can be so happy if your patients are getting those. And I use like an online pharmacy where everything's pre-screened and and all that, which is absolutely wonderful. I love doing that. But there are so many brands above and beyond that, and now there's third-party resources that will check these things for quality, and if they're claiming organic, and all this. So even though we don't have FDA regulation, they're still very high quality, and I think that has gone in a good direction. Although I would still caution people, and just like I say in my book too, don't go to your average grocery store or your average, general store and purchase the supplements off the shelf, because those still might not be the best, right? So always ask, a natural healthcare practitioner, go to a natural foods grocer, go to something like that. That's typically where you're going to find the best quality supplements. But this is also your realm, so I'd love to hear your take on it.
Well, I agree 100%, and thank you for your comments, because I think we're on the same wavelength. I think that people need to realize today that sometimes we feel that a little bit of something is better than absolutely nothing. And if we like it, even though it's not great for us, we think to ourselves, well, at least I'm doing something. But are you? I mean, really, are you really doing anything good for yourselves? See, I think the progress of the natural products industry is still the brick and the mortar of the small mom and pop health food stores and the smaller chains, because these are places when you can go have a one-on-one conversation and lead the conversation how it applies to you and your individual situation. Do I feel that you can do that online? No. I feel that, online has been fantastic, but how many people miss the boat because they're doing the eeny, meeny, miny, mo online, guessing, and they may be overlooking that one product that may make a difference. I've learned, because I do lectures all over the country. I'm all on the road all the time. And when I'm doing a consumer lecture and I look out in the audience and I see light bulbs popping up over people's heads, I know that I'm getting through. Or you see the, oh, look on their face, that you clarified something that they have either been thinking about or maybe doing incorrectly, thinking they were doing it right. And you gave them enough information that they could actually say, that resonates with me. And I think that's really, really important. I think that our industry is failing in a little bit because many of the companies have cut back on their modules of education and training. And to me, that's kind of where I'm trying to fill the void, because of the fact that I think that we need to get back to that. Because if you are a retailer and you have employees in your store and new products come on and they're sitting on a shelf, but you've never been educated on it, you don't know why they're different. You don't know how they're differently made. You don't know how they source. You can't become an ambassador behind a line that you've never been trained on. So you're not going to have a communication on something that could be absolutely fantastic because nobody ever told you what it was. So that wonderful line of products ends up missing the boat because there was nobody there to ever teach the people that are out in the trenches every day. So it comes to education, and I think that your book is going to make a dramatic difference. Do me a favor, show your book again. I think this is going to be a great addition. The Secret to Never Getting Sick, Why You Got Sick, and let's face it, Why It's Your Fault, by Dr. David Hopper. This would be a great addition to your library. Like he said, you can do it on Audible. You can do it on Amazon as well. There are books that I like to endorse, and they're books that I feel are written from someone from their passion, their experience, and their heart. And they're trying to provide people the tools. Back to your car thing again. If you're trying to fix the car, you need to have the right tools to get it done. You can't fix your engine with a screwdriver and one ratchet. It ain't going to happen. You need a lot of different tools. Information like this helps to teach you what to look for, how to understand what you're looking at, how to maybe move forward, how to have questions and get the answers that you need. And I think we all need that. I think that we're not prioritizing our health like we really should. We're so locked up in deadlines and research and projects and all this kind of stuff. We get a 2-day weekend. The first day, you're just literally exhausted from the previous week. You get 1 day to kind of do something, and then you're right back in again. Where was your downtime? Where was your focus on me time? Where was the time when you thought to yourself, I just need to have some me moments? Sometimes people think those me moments are selfish. Yeah, they are.
But
they're deserved.
That's something I like to talk about a lot right there is that if you don't take care of yourself first, right, that is, if I asked you, right, does it seem selfish that I work out every day, that I spend a little bit of extra money on quality food every day, right? Do these things seem selfish? And some people would say yes, right? But here's the thing. If I didn't do those things and I started to have some kind of chronic disease, I had to end up hospitalized. I had to end up with this, with that, right? And then my family has to take care of me instead of me taking care of them. I have to have people cover for me at work. I have to have somebody drive me around, right? Now, doesn't that seem more selfish, right? Because, right, did I choose that then? Right, because you're choosing one or the other. So it's really, right. We can look at it from that perspective. Which I hope I hope everybody understands where I'm coming from with that. but.
I think so, definitely. First of all, I have loved and enjoyed this so much. I'm so glad you were able to come. Do me a favor. Question number one, will you come back and see me again?
This has been really fun. I love the conversation. Yes.
Perfect. Number two, your question of the day. David, you have to leave the earth today forever. What would you like to be remembered for?
For raising amazing kids, leaving some amazing humans on this earth who can carry on the things that I have instilled in them, and hopefully make a great impact themselves. So I think my kids, I have 2 of them right now. They're both pretty young, and that would be it for raising some amazing children, and who hopefully go on to make a great impact.
I love that.
Yes.
That's beautiful. Show the book again, Dave. Once again, the book, The Secret to Never Getting Sick, Why You Got Sick, and you know it, Why It's Your Own Fault. Let's pay attention. Let's listen to the signals. The body doesn't need to be screaming at you. It can be whispering. We just need to listen. I thank you all for tuning in today. Dr. David Hopper, my guest. I hope you enjoyed this. If you took away even one little point, even if you didn't, tell your friends to listen to this episode. go to my YouTube channel. Remember, you can go to my webpage, Dr. Jeffrey Burke. You can tap on the Honest Health logo. It'll take you to all the platforms. You can, of course, go to my YouTube channel, and you know it, subscribe. Subscribing does a lot of things. What it does more than anything is it allows better visibility of my shows and better attention to my amazing guests. So I hope you'll take the time to spend some time at the YouTube channel, listen to some of these absolutely phenomenal interviews I'm so blessed to have. And David, thank you so much for being here. My guest today, Dr. David Hopper. Thank you so much for being here. Thank you for taking the time out of your schedule.
Thank you, Dr. Jeff.
And David, once again, thank you, sir. Be well, everybody. Have a great day. Do something just for you. It's not selfish. Well, maybe a little, but it's okay. Have a great day. God bless.
Stay tuned for more information from the Honest Health Podcast with Jeffrey Burke. And make sure to check back often for interviews and conversations from the guests we all want to hear from. I'm John the Announcer. Thanks for listening.